Welcome to the best kept secrets in healthcare. Today, I want to talk to you about one of the scariest secrets, and that is what the actual number one cause of death in the United States. Most people won't believe this when we get into it. So I'm going to show you actual statistics to show you what are the actual causes of death, why people are dying in the United States. So first, we're going to start at the CDC website. I'm going to share my screen with you so you can kind of see exactly what the CDC says is the number one causes of death in the United States. Okay, so here we are. We're looking up here, number of deaths for leading causes of death. This is data in the USA, and this is for the year 2024, all right, this last year. So number one, heart disease, kind of to be expected, right? 680,000, 681,000. Then cancer, accidental, that could be car wrecks, fall off your roof, hurt on the job. Strokes is number four, chronic lower respiratory disease, and then you got Alzheimer's, diabetes. No one really dies from diabetes, but the side effects that go along with diabetes, chronic liver, and then supposedly COVID. That's another rabbit hole. We're not going to get that. So these are what the CDC ranks as the overall cause of death. Now, what I want to talk to you about is something else. It's called iatrogenic disease, in this case, iatrogenic death. Most people haven't heard that term because they don't publicize it a whole lot, but iatrogenic means doctor-induced. It means you'd be alive today had you not done something your doctor told you to do. So there was a group of researchers, a combination of medical doctors and PhDs, no chiropractors, that actually, they just went out and added the numbers up. And I'm going to show you here in just a second. It was a report called Death by Medicine. It was published in the Journal of American Medical Association. Obviously, you've never heard it before, more than likely, because it's not something that they want published. And the same people that control big pharma, control the media industry, and so not the kind of information they want to get out. So fortunately today, though, we're going to share it with you. We found it. If you can Google Death by Medicine PDF, and this form will actually show up. It's research. What they did was they just went out and added up why people were dying in the United States from the medical standpoint, medical industry, and then just put it in the statistics. So I'm going to switch over now to and pull that specific one up here. And let me go back to my screen and share that particular page. And here we go. Death by medicine. Okay. That's what this report is called. And you can see up here to the top, death by medicine. We're going to scroll down to the actual numbers, right? So here's table one, estimated annual mortality and economic cost of medical information. Now, I will tell you that this is from 2001, which means these numbers are more than likely much, 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 much higher by now. Because if you look at any one of these conditions, any one of these causes of death, they've actually gone this way. None of them have gone down. They've only gone up. But we're comparing 2001 to 2024, and it's actually probably a lot higher than what we see here. But this is what we come up with. So the causes, the conditions that they're relating to iatrogenic, mean doctor-induced. This is adverse drug reactions. Okay, so those are people that were alive today and given a medication by a medical doctor, said, oh, okay, take this medication. And as a result of taking the medication, they had an adverse reaction, died. Okay, it actually happened to me, my father-in-law, same exact thing. Gave him medication, within a week he was dead from one dose. All right. Medical errors, obviously medical mistakes, okay? Bed sores, so those are people in a hospital bed. They're not rolling them, not moving around. They're just basically stuck in there. Ultimately, they die from a bed sore. Hospital-induced infections, get into a hospital, you wind up getting some sort of infection because you're there to begin with, and it kills you. Malnutrition from being in the hospital, not feeding you the right food, which the food in hospitals are horrible and definitely not healthy. Outpatient services, unnecessary procedures, surgery related. So somebody went in for surgery, and as a result, they took out the wrong kidney or whatever. Ultimately, they wound up being dead as a result. Now, if you look at the number down here, the total number, 784,000 people every year are dying from iatrogenic causes, from following their doctor's instructions. Now, if we go back to that CDC page, let's see. Well, how do I do it? Okay, sorry. I'm a little slow today. Okay, we go back to the CDC page. Look, the number one leading cause of death, they say, is 680,000. The number one cause from iatrogenic was 780,000, and that was in 2001. And it's greater now than it is. I don't know what it is because they haven't done a study like this since, and they probably won't because they didn't like this one when it came out, obviously. So, what that means is the number one reason people dying in the United States is from listening to their doctor and following their doctor's instructions. That should blow your mind, right? So the place where we supposedly go to get health, to get better, to feel better is the number one reason people are dying. Now, let's go to the next page. If you look at, remember, these researchers were all PhDs and MDs, okay? So they just went out and added the numbers up. And what they say, they believe that this is, they say that this number is at best 5 times this amount, could be as high as 20. So what they're saying, and just to put this in perspective, 784,000 people a year, this would be the equivalent of 6 jumbo jet planes falling out of the sky every single day in the United States. 6 747s falling out of the sky, crashing in the United States every single day, 365 days a year. Now, if that happened, you think that would make the news? You would think so. Why haven't any of us ever heard this report before? How come we've never even heard the term iatrogenic disease before? Again, remember who I told you, the same people who control Big Pharma control the media. They don't want you to know this. Now, think about this. How many people died in 9/11? Like 3,000 people. And there's a memorial. There's every year it's recognized. You know, that was a big deal. Just 3,000 people. We're looking at 784,000 people that have died in a year and nobody even knows. Now, let's scroll down to a couple pages. And remember, I didn't write this, I didn't say this, but what they say is if you look under underreported of iatrogenic events, as few as 5%, no more than 20% of iatrogenic acts are even reported. This implies that if medical errors were completely and accurately reported, we would have an annual iatrogenic death toll much higher than 784,000 people in 1994. Leap said the figure 180,000 medical mistakes. Oh, that was a study that came out in 1984. In 1984, Leap said 180,000 medical mistakes result in death annual was equivalent to 3 jumbo jets crashing every 2 days. Our considerably higher figures come to 6 jumbo jets are falling out of the sky each and every single day. But now, if you go back to that 5% to 20%, that means that this number isn't 6 jumbo jet planes. It could be as many as 30 or even up to 120 if you figured the 5%, 20% rule. So that's pretty scary. The number one place we go to hopefully get better, to get help for whatever ails you, is the primary cause of death in the United States. So I tell you this not to scare you, but to make you aware. And the next time someone, just because they have a long white coat, offers to write you a prescription or some sort of surgery or some sort of treatment, research it a little bit, right? Nowadays, you can go on Facebook, you can go online. I'm sure there's probably a support group. There's probably a lot of information on any drug they might prescribe. What are the side effects? Go to the PDR, Physician's Desk Reference, is like the drug Bible. It pretty much gives you all the side effects and potential risks. Talk to anyone that's ever taken the medication, anyone that's ever had this particular condition. What did they do? Look for alternative models. Always go to the least invasive. Start at the least invasive form of care first. Chiropractic is great. The worst potential outcome is no outcome. Okay. But a lot of patients get well from different forms of chiropractic. Upper cervical is my specialty, but, it's a great alternative to medicine and surgery, at least to start with, to see if you can get the help you're looking for, because again, there's no negative outcome. The only negative outcome is no result, right? which most of the time that's rare, right? And at least in our office. And then look at, alternatives like different nutritional supplements, going to holistic providers, people that look at the body as a whole, not just as a disease or as a condition that they're trying to treat. Look at for people who are trying to correct the cause of the problem, not just treat the symptoms. Um, medical the medical system, the medical model as a whole doesn't treat the body holistically. It's more of a crisis care, disease care model where they're actually just trying to make you feel better, right? They give you a medication because medications cover up symptoms. They don't fix anything. No one has ever had a health condition that was the result of a lack of medication or a drug deficiency. So, people don't have headaches because they have a Tylenol deficiency, right? So taking a Tylenol has never fixed the headache. It only masks the problem. But the problem is sometimes when the drug itself can have worse side effects than what they're trying to teach or trying to treat. And when that happens, a lot of times you take a medication, it'll mask the problem, but in the process, your body's getting sicker. Migraines is a good example. So if you know anyone with migraines, a study came out about 12 years ago that they found that people with long-term migraines, what they considered long-term was 10 years or more, that suffer from migraines for more than 10 years, 80% of those migraine sufferers have a stroke. 80% of long-term migraine sufferers have a stroke. So that's not good odds, right? If you have migraines or if you know anyone with migraines, from our standpoint, it's a very simple fix. It's a nerve system problem. It starts at the brainstem. But so the mechanism for a migraine is you need blood flow to the brain, right? So the problem is the blood vessels that allow the blood flow also have to open up. They have to dilate, allow for the extra blood flow. Well, if there's a bone outline in the neck, if it's interfering with the nerve messages to the blood vessels, they don't dilate. They don't open up like they should. So you're trying to squeeze a lot of blood through a small opening. Those blood vessels get inflamed. They get irritated, which causes them to become inflamed. That creates the pain of a migraine. The lack of blood flow to the brain creates the aura and the other side effects. Very simple for us. We just find the pressure at the brainstem, remove it. Blood vessels dilate. You get proper blood flow. Migraines go away. Almost 100%. But from the medical standpoint, you take your Excedrin migraine, your Imitrex, whatever it is you're treating the pain with, and maybe the pain feels better. Sometimes it does, sometimes it doesn't. But you're not fixing anything. So over time, you're slowly starving the brain because you're getting a lack of blood flow for months, years, chronically over 10 years. Then what eventually happens is you starve the brain to the point where it dies. That's a stroke. That's exactly what a stroke is it's a starvation of the brain where part of it actually dies because of lack of blood flow. So that's one example of how the medical approach is literally making you feel better while you die. I mean, and here's the results right here. It just shows you. And these are short term. I mean, immediate effects where you can see it. They don't see the long term. If you were to put in the long term effects, like taking a medication over a long period of time, how that can affect you. The number one cause of liver failure in the United States is ibuprofen. The number one cause of kidney failure in the United States is Tylenol. Number one cause of stomach disease in the United States is aspirin. So taking medications like that, although it makes you feel better, at the same time, it is making your body sicker over time. So always look at the least invasive approach first. Try to find a way that you can get the help you're looking for without any negative consequences. Any iatrogenic type reaction is not good. So again, I hope this makes sense to you. I feel like if you don't hear this here, you're probably never going to hear it, which is why I wanted to create this short podcast to make you aware of what the potentials are when looking for different healthcare sources. Do your research. If there's anything we can do to help, contact us. We'll be more than happy to help direct you in the right direction, the way that might give you some help without necessarily having the negative side effects. So if this makes sense to you, please like our podcast. Please share this because, again, like I said, you heard it here, but most people aren't going to hear it here unless you forward it to them or you share it. And then hopefully we can get the message out to the world and we can create a happy, healthier world we live in. Okay? You guys, and hope this makes sense. And I look forward to seeing you on the next podcast. Have a great day.